action.
Hi, I'm Sydney. I'm going to be a student nurse today. I'm going to be doing your abdominal exam. So this exam is going to involve me touching you and palpating your abdomen, and I'm going to be listening for things. Is that all right with you?
Yes.
All right. Well, I'm going to go ahead and close the curtain, give us some privacy, and I'm going to do my hand hygiene. I'm going to start with some history questions. So have you had any abdominal pain recently?
No.
Have you had any changes in your bowel movement or in the frequency of them?
No.
Have you had any back pain?
No.
What about any problems urinating? Okay. Have you had any genital discharge?
No.
Have you had are you sexually active?
No.
Okay. I'm gonna start by asking you to remove your shirt. If you were in the hospital setting, I would be removing his gown and properly draping him. I'm gonna go ahead and put some gloves on, and I'm gonna ask you to lay down. Okay, he's in the supine position. I'm going to bend his knees and have them slightly bent. All right, so I'm starting by inspecting his abdomen. I see even hair distribution. The shape, the size and symmetry is good, and contour of the abdomen is good. The skin condition, I said there's even hair distribution. There's no lesions, no scars. I'm not seeing any abdominal movement. I'm not seeing any striae or any superficial veins. So his abdomen looks good. I'm going to ask you to raise your head like you're doing a sit-up, and I'm looking for any abdominal distension. He doesn't have any distension. You can go ahead and lay your head back now. If I did see any distension, I would note the girth of the abdominal hernia during my palpation assessment. I'm looking at his umbilicus. It is midline. The color is normal and the contour is good. I would have had him void before this exam, and I would have noted the color, odor, and turbidity of the urine. But I'm going to listen to his bowel sounds now. I'm going to listen for clicks and gurgles. Normal is about about 5 to 30 per minute. And bowel sounds are most active right after someone eats and 5 to 6 hours after that. I'm going to start in his right upper quadrant, then move to the left upper quadrant, then to the left lower quadrant, and then to the right lower quadrant. And that is the pattern that I'm going to be using for all of my exams. His bowel sounds are normal. I'm going to switch to the bell of my stethoscope here to listen for bruits. and I'm going to slide my stethoscope under your pants a little bit so that I can listen to your femoral artery. Okay, I didn't hear any bruits, and I shouldn't. I was listening in several locations in each quadrant, and for bruits, I was listening to his aorta, his renal arteries, his iliac arteries, and his femoral arteries. All right, so I'm going to move on to percussion. So I'm going to tap on your belly a little bit. I'm expecting tympany over the stomach, and I'm expecting to hear dullness when I move over organs. So I'm going to start in the right upper quadrant. Okay, and I would use a fist or blunt percussion if I suspected kidney or urinary tract problems. Okay, so now I'm going to start palpating. I'm going to move 1 to 2 centimeters in, and I'm going to rotate. I'm checking for any tenderness, muscle rigidity, any rebound tenderness. Any of this hurt? If you did have any tenderness anywhere, I would palpate that area last. Okay. Now deep percussion or deep palpation is usually only done by practitioners. It's used to feel organs for masses and size. I'm going to palpate your liver. I'm going to stand on his right side, place my hand under here. I'm going to ask you to take a deep breath in and then a slow breath out. Okay. And now I'm going to do a spleen. I'm going to place my hand under a little bit farther. Deep breath in. All right, that's going to conclude our assessment. I'm going to go ahead and put your shirt back on, and I'm going to go ahead and take off my gloves and do my hand hygiene again. Do you need anything else before I leave? My shirt. Your shirt. All right, well, I'm going to leave you with your call button if you need anything. All right, and that's going to conclude our assessment.
Is there a reason that you listened first?
Oh, I listened first because if you percuss before you listen, then you might mess up the vowel sounds, and they might be different than what you would have heard before.